I started with law enforcement in 1984 with the New Mexico State Police, and a few years later I went to the Albuquerque Police Department. I've been there ever since. When the program first began, I was opposed to this program in Albuquerque. And prior to my present assignment, I was an area commander, so I guess it's equivalent to a district commander here. I had 100 and some officers, about 150 officers working for me in the Northeast Area Command. And the way it worked is it would not bring the program into your area command if you were opposed to it, and I was opposed to it. Now this is really important. Let me explain the card to you at this stage. It's in your blue packet. Did you guys get the blue packet yet? Okay. Yeah, this card here is a card that Prevention Point Philadelphia issues. Now these are blank cards. Normally you'd have a number on the back that would identify the participant. But what's so important about this, and I'll tell you why this works so well in Connecticut. In 1995, their study found that they reduced accidental needle sticks to law enforcement by 66% after the needle exchange program was initiated. But what makes this program successful is the fact that they get to keep their cards. If this program won't be successful and it won't benefit you or the community or the user if this card is taken away from them. If the officer takes the card and thinks that they're doing some kind of service to the department or whatever the reason is, contempt of cop or whatever it may be, but they take the card for some reason, then what you have done is you've put your fellow officer that comes behind you at risk. What we have found in Albuquerque is that when they have the card and they're not afraid of going to jail, they're very, very forthright with us. They tell us that they're involved in the program, they tell us where their dirty needles are so we don't have to chance encounter them, and they tell us what they have on board as far as diseases. But if they don't have this card, if an officer is taking this card away from them, the next officer comes up, do you think they're going to be honest with them? They're not. They're going to lie to that officer. And so you basically put your fellow officer at risk if you take this card. If there's a sterile needle and you stick yourself with a sterile needle, it doesn't matter. Nothing's going to happen. You stick yourself with a dirty needle, not only is it a dirty needle, you don't know how many people have used that needle. You don't know if that is the only person that used that needle, or if that needle has been passed around for a number of days and there's been a dozen people that use that needle. In the U.S., every 30 seconds there's a needle stick to the healthcare or law enforcement professionals, every 30 seconds. So you think about that. That's a real eye-opener.